Hello, EEG fam. Today we have a really important discussion. This is Mental Health Awareness Month, and I had the absolute pleasure to have Mr. Brian Galdis on to speak about some very personal things that he has gone through dealing with mental health and how he's overcome and the struggles that he still is dealing with. Brian is an incredibly successful guide in our industry. He is the president-elect for ABRET. He is an administrator in his hospital. He's just an overall mentor in our industry, and he's just an absolute wealth of knowledge. If you feel like any of these topics that we're discussing is a little sensitive for you, please feel free to stop and ask for help. We do talk about what that looks like. So if you are up for it, I encourage you to listen to the end, because Brian's story is one that I think we can all relate to and get inspiration from. So it is Mental Health Awareness Month, and for that, we are going to release this episode first. You might hear us referring to the first episode because we recorded an episode thinking that was going to be the first episode, but we decided that this episode is going to come out first, given that it is Mental Health Awareness Month. I'm blabbering. Thank you so much for tuning in. I think this is a very incredible conversation that you will hopefully find value in. And thanks to Mr. Brian Galdis for opening up.
You can't pour from an empty cup, even though it might be cliche. It does resonate. I think a lot of us in healthcare, our whole focus is everyone else. How do we help other people if our cup's empty and we're not helping ourselves?
Mm-hmm.
I think the biggest thing is having the strength to ask for help, not looking at needing help as a weakness.
Brian, round two. Your first episode was really encouraging. And I think so many technologists or so many people in our industry they loved to hear your story and how you were able to kind of grow in our field. I think maybe a lot of people in our field might feel stuck. And I think that is, it's really refreshing to hear that you're not stuck. There's just certain ways you can go about advancing your career. So thank you so much for that first episode, dude. It was such such a great conversation, and I'm getting to know you over the past in emails and just even breakfast. I'm incredibly fascinated with your story and how you are an open book, and we're going to dive into some pretty heavy stuff today. You've dealt with some heavy things, and I think everyone needs to hear this. And maybe in our industry, it's not talked about enough, and that is mental health, such things as dealing with depression and self-harm that you experienced when you were young, and maybe even still do, because it's an ongoing thing. I know I do, and it's about time that this industry talks about it, because dealing with stressful situations where we're dealing with pediatric children, or I've had cases, where it's, car crashes and young kids are involved. Mm-hmm. That affects us, and nurses have support. Obviously, they need more. It's almost like we don't, as technologists, EEG technologists, the conversation's not there. So I'm incredibly thankful that you're gonna share that part, and hopefully that'll inspire me to open up a little bit about my own weaknesses and strengths of dealing with mental health issues. So thank you very much, and let's first talk about, when did you notice that you were struggling with depression and self-harm? Was it early on as a child?
Yeah, it was. And that's where I feel like this is, in the last number of years, I feel like I've really wanted to, it's difficult to share, but also knowing that I didn't have the support. And I think there's a lot of things, growing up too, And it was a different time period and those types of things. But yeah, I can remember as early back as second grade having some pretty significant depressive thoughts. There was a lot that stemmed from being just severely bullied. I was always a little bit overweight growing up. I was very shy, very quiet. And in essence, from that perspective, an easy target, I guess, is what kind of kept happening. And as I got older, it just, it continued. The bullying continued, usually about my weight, and usually just because I, didn't know how to defend myself in terms of, standing up for myself, being confident, and those types of things. And those depressive thoughts and that depression just kept pulling me down and really weighing on my self-worth. I think the first time that I can remember having thoughts of self-harm was back in the 6th grade. And just feeling that I was a burden on the people I loved. I think that's the challenge. I think that's what people don't maybe understand sometimes about depression or those feelings of self-harm was, it was just a very lonely place. I didn't feel, and honestly, it was much more the perspective of that what I was going through. My troubles, it
was unique to you.
Well, yeah, and that the people around me, my friend, family, they didn't deserve to have to help. And again, they didn't do anything. They didn't feel that way. I know internally, it's how I saw things. It's how that depression really set itself aside in my mind was that I should be able to do these things. I should be able to get better. I should be able to be happy. And I shouldn't be putting that on other people. But I also didn't know how to be happy. I didn't know how to feel value in myself.
Nor did you probably have the ability to think that you needed to find out what's going on. Yeah.
Yeah. And I think that's part of, when we look at, you can look at statistics and whatnot and the rise of mental health concerns in kids and just in adults as well. But being that self-harm is the second leading cause of death in children, that's pretty significant.
Yeah.
But it's around having, where, I guess for me, going back to, those things don't just go away then either. If you don't, and I didn't know how to deal with them. I didn't know how to process them really appropriately and continued to just feel very alone. And that other people didn't feel this way, so not really knowing how to talk to people about it, if I should, how I would be perceived. I think that really falls into the stigma. And let's, think back that this was, I grew up in the 80s and 90s. So different world views, different, what we talked about, what we didn't talk about. And that's really, there was a stigma, there still is.
Yeah.
And that's what's a big challenge. Things are getting better, but I feel like that's where I also, personally, it's challenging still to talk about.
Yeah.
Because it's very personal, and it's even back then, it's like being vulnerable is what I felt like was putting me in positions where I felt bad about myself, like or that it wasn't okay to be vulnerable.
When did you feel like when did you feel a pivot point to where you thought, I do have a mental health issue? Because, starting at that age, so many of us just think, oh, that's just the normal way of life. And you just go through that. And without recognizing that there is an issue, you can't really address it. So around what age were you like, I need to there's something that I need to figure out here?
Yeah, I think I didn't really understand the extent until I was in college.
Okay. So you had dealt with this in middle school and high school, and then into college. You just thought, hey, this is the status quo. This is how I'm wired. I don't need to change anything because there's nothing to change. It's just how I'm dealt.
Yeah, to a degree. Yeah, I think just similar to what you're saying. Like I didn't know that there was a different way to feel.
Mm-hmm.
I didn't know that this wasn't as, in essence, maybe as abnormal or in essence, just what normal should be.
Right.
This is just how things were, and it was very desolate and alone. I think one thing, and I think what you had asked around that too is really kind of coming to mind is, college for me was an opportunity to reinvent myself. It was really I was really excited about my freshman year of college. Like all those things that I had been through, the people that I'd been with, or, the people that tormented me, bullied me, those type of things, they were, they were gone.
Yeah. You were escaping them.
No one, I was going to a place where no one knew me. I didn't have, in essence, in my thoughts, I was like, I didn't have to be that person anymore.
Mm-hmm.
I can be whoever I want to be. And, these people don't know me from anything. And I think that's where, it seemed maybe better, things were better in the kind of like my freshman, sophomore year.
Did you notice a significant shift from your mentality from high school to college? Like, did you know, hey, I'm getting better because I feel excited about this new place?
Well, I think that's where like what you were asking before is
how you
what
knew.
Is the way how I realized that things weren't better was I did those things, and
Mm-hmm.
yes, for a very short period of times things were better, but underlying and just internally it was still there.
Yeah.
And it was still dragging me down, and I still had significant problems with self-worth.
Yeah. And that was the indicator that you needed to, there was something that was needed to be done.
And I think, and that was the other thing. It's similar to our last conversation of when, like really, I knew there was something, but I wasn't still acknowledging it to the fullest degree. I actually, interesting story. And so I was a physiology major, but really I took a psych class, got really interested in psychology.
Mm-hmm.
So I decided to start taking all my electives in psychology. So I was sitting in my abnormal psych class, and that's probably sophomore year.
Yeah.
And just, sitting in class, and we're talking about eating disorders, anorexia and bulimia. And as the professor's going through, I started getting really anxious because everything that they was describing were things that I was doing.
Mm-hmm.
And I never knew there were two types of bulimia at that time. Because what I was doing was I was excessively working out. I was kind of fasting and excessively working out. I would go on a 5-mile run.
Yeah.
And then I'd go on a 5-mile run in the evening. I would work out constantly.
Was were you using that as an antidote to your depression?
Yeah, and that was the other thing, is because a lot of my self-worth was revolving around my appearance. I was bullied so much for being overweight,
Mm-hmm.
That I thought in my distorted framework, that if I looked better, I would feel better, and
Mhm.
people would accept me.
Yeah.
And I wouldn't continually have relationships where people, left me or treated me poorly because if they can't pick on my weight,
There's
then,
nothing else.
then I'm okay.
Yeah.
But that just wasn't. And so I developed other poor behaviors, and coping mechanisms, basically. And that's where the bulimia came in, is I wasn't purging from a traditional sense, but there's the type 2 where you binge and fast and then fast or work out excessively.
Yeah.
And that was another one of those moments where it was like, okay, this is what I'm doing, but still not knowing where to turn and what to do, because again, that stigma, like, who do I tell this to? I'm ashamed of what I'm doing, but I can't stop doing it. I think it kind of goes back to some of that stuff with leaving medical too. Like, it's the stigma kind of goes around like that. This is a weakness.
Yeah.
This is, and am I in essence a failure, or just unable to just deal with it? Because I think the old adage of just like, things will get better. Just don't, just be happy. The old great advice that you would get back in the day, of totally not understanding what someone was going through.
Yeah, the old 80s and 90s, which, Brian, I'm going to say your age. You're 47 years old, because I have to say that because it's so hard to believe with that hair and and no grays, and so that old the mentality of 80s 90s, hey, pull yourself up by your bootstraps and get over it. While there is some while there is some truth to, you need to be the one to take ownership and pull yourself up, it's not necessarily that kind of white knuckle approach that is helpful. And speaking of, you're an incredibly successful person. Talking to you, I can tell that, and through what you've told me, you're able to manage it way better than you were back then. What were the pivotal points where you said, you know what? My mental health is just as important as my physical health, and this is what I'm going to do to improve.
Yeah, and it honestly is I guess to again kind of reference our last conversation, it wasn't a straight path. It was medical school where I think it was the culmination of being so educationally, intellectually challenged by medical school in a way that I hadn't been in college. I think college wasn't, I did really well in college, and I'm a perfectionist. And so when I struggled with medical school, I think that started to really continue to bring a huge weight of that depression. Not that it wasn't still there, not that it wasn't there leading up to that, but I think that overwhelming from a place that I hadn't been overwhelmed before only made it worse. And I was able, and at that point, realizing too that, and recognizing that I needed to do something. Similar to what you were just saying, like, I can't just make it go away, but I can't do this by myself.
Right. So you evaluated your life and probably took note of what is making you depressed, and then you acted on that, right? And again, what we talked about in the last episode, you quit medical school, which had to have been hard, and probably some of the things that you have to do to protect your mental health is to make decisions that people would judge you for, and stuff like that. Do you think that was the pivot point where you decided, this isn't for me, I'm going to do something to make sure that I'm mentally healthy?
Yeah, well, yes and no. I mean, there's components of that. So first year medical school, was realizing that I needed to do something. If I was going to get through medical school, I needed to address this depression that's been weighing me down and been overwhelming my entire life. And along with that, self-harm and all of those things. And so my ex at the time, and we went to a counselor from the medical school, and they actually got me set up with a psychiatrist. And so that was the first time I'd ever, I was 25, I think, 26, like, and maybe 24, I don't know.
Yeah, some age.
But so that was the first time I got an actual diagnosis.
Yeah.
And again, as we talked about, 17 years too late, but still, I was talking to someone. And that's really what it came down to with me is I had so much trauma through life and that, I went to a counselor every week, on a very regular basis, those types of things. And that's where I think when the medical school stuff was, I felt like I was getting better, but there was a lot there. It's not something where you just snap your fingers, even being on, medication for the first time, I could see improvements. I could see what baseline maybe should feel like, and not getting so low in those types of things and not feeling that. But there was also a lot of the need to like really unpack with somebody who could help me see things from a different perspective.
Yeah.
Because I only could see things through one lens of depression and just self-loathing. And so, even today, you saying like that I'm successful, like that is hard. Like I don't see myself as successful.
Right. It's hard to hear.
And it's not necessarily depression. It's just there's some of that.
Yeah.
Historically, I think does still kind of sit in, and weigh into. So I think it's a challenge every day.
Yeah.
And that's where this wasn't like a straight path. Like, just going and getting help, it was the right step forward. But leaving medical school, I actually it was the person that I was seeing, he took a different job in another state. So I tried with a new psychiatrist, and and this was I don't remember, it felt like all he wanted to do was medicate me more.
Okay.
I didn't feel a connection that I felt with the other psychiatrist of like being able to trust, and you have to have trust. And that's one of the biggest things when it comes from mental health. So you have to know that you deserve to feel better, that you don't deserve to feel that way. And then you have to be able to trust so finding a psychiatrist or finding a psychologist or finding someone who you can talk to, there has to be a connection there. Yeah. If there's not, you're not going to be open. You're not going to share as much. So I basically didn't find somebody, and some other things happened in life, and I didn't continue.
Yeah.
So unfortunately, I stayed on medication, but I wasn't talking to anybody. And so things were still lingering. Things were started to get worse. So that's why I say it's not a clear path, or straight path. I got better, and then I started to get worse again.
Yeah.
And that's where, I hit a very low part in my life, and really didn't know what I was going to do, didn't know where I fit, and really, started developing very significant feelings of self-harm.
Yeah.
And became more serious about it, and really, and so those were places that, and again, this is why, I talk about it now, and again, this is maybe only the second time, but to be, from a public perspective, because it's, I don't want other people to feel that alone.
Yeah.
I want to make sure that people know that, that is not.
There's hope.
Yeah, there's hope. There's.
Do you bring that into your leadership role, like at work, like how and you're probably limited, but how does a leader help and really guide his team and lead his team to be mentally healthy?
And so I've been super proud of my team. I think just individuals in my team have recognized that, they need some help from that perspective. We have some great resources at my institution that as leaders we can provide them. And I know that that's not everywhere.
Yeah.
But even just being able to talk to someone and say like that, and it's not, and I think that's where this is still challenging. So when you talk about leadership, I think that's the other thing is, coming from an age when I came from, and, is the idea that a leader is fearless and confident and, has no flaws and, charged.
Yeah.
That's not, I think there's been a lot of great stuff out there from, psychologists like, Brene Brown and Adam Grant and like people that vulnerability is a key part of leadership. And I'm not saying I do this well because this is difficult for me. And that's what being in a leadership position has been difficult too, because I've been so used to a childhood where like having been picked apart for different things, like it's been challenging for me to be a vulnerable leader and open up about any of like this kind of stuff with my team because I instantly have fears that'll be used against me.
Mm-hmm.
When in essence, that again, that's perspective, it's not assuming positive intent.
Mm-hmm. Yeah.
But again, it's from years of trauma, and so it's not easy to get through that. But that's where I've really need to put myself out there more as a leader, and I hope that what I can show that my team and anyone else is that those things are important, and I do it in ways not necessarily like that. I don't go into our huddle every morning and talk about my personal stories and whatnot, but I try to make sure that they know, whether it be through our like weekly emails and stuff or like what avenues are out there. Like it's, Mental Health Awareness Month, here's the different things that our organization has available for you. Here's stuff that I've, done in the past, those types of things to make sure that people know that maybe they're not at a place where they feel comfortable,
mm-hmm.
but they're seeing things that show that, I have avenues and I don't have to necessarily open up and share my story to everybody, but
they're not alone.
They're not alone. And somebody, and here's some opportunities that when I need them, I can go do them.
And there's still that stigma, even though we've come leaps and bounds since the 80s and 90s, even if it's just stigma within ourselves, because I think nowadays, for the most part, when you say, I have a therapist, it might shock somebody, one of your friends, but I think I hope we're living in a day and age where they're like, oh yeah, that's normal now. And there are probably still some people, and it's real hard for men, I think a lot, to go and see and talk to somebody. And I equate it to, do you look at a guy who goes to the gym every day as weak? No, you don't. He's working on his physical health. Same way you shouldn't look at a guy who goes and sees a therapist, every day even. It's almost admirable because the easy route is not doing anything. The easy route is just saying, oh, I'll be fine and I'm just going to deal with it. The hard part is confronting your thoughts, improving yourself mentally, and protecting yourself in that way.
Yeah, and I know I've said it to my team in a team setting, and whether it comes around like the times of just really trying to bring awareness on like Mental Health Awareness Month or whatever, but I've tried to, and I should do it more, and I take that away as just something that but I've said it before, like it takes a lot more strength to ask for help.
Mm-hmm.
You are stronger asking for help than assuming you can go it alone.
Yeah.
And not to see asking for help as a weakness that I need. It takes courage and strength to reach out and and ask for help. You had said something too, and it just kind of brought up another memory. I think, you're right. Men have it's still ingrained, whether from a societal standpoint, machismo and all this, just kind of that, men need to figure it out. Women are the more sensitive and they are in tune with their emotions, and men, they just can get through everything and they don't, again, it's kind of it's that same dichotomy of leadership, it's these false pretenses that, society, whether it be societal or generational. But that was one of the fears that I had from a mental health perspective is I worried when I would go in, drive to my psychiatrist's office, and at various times in my past, worried that I'd run into somebody, walk in and get into that conversation of, oh, where are you? Oh, hey, where are you heading? Mm-hmm. And not wanting to say that, or again, being fearful of what someone would think of me if I admitted that. And I think that's a fear from a leadership perspective too.
Of course.
And this is where we try to be, where leaders need to be more vulnerable, but at the same time, there's that concern that I'm going to be seen as weak, or I'm going to be seen as someone who can't do my job or lead others, or, that again, that it's really that stigma. And really it boils down to weakness and how someone, you worry that, the wrong person isn't going to see you as someone who can or should be in a leadership role if you can't, work through that type of thing. But again, like you said, I do think things are changing. I think there's great strides happening. I think there's a lot of, material and research and just work out there that's trying to change the narrative.
Well, I honestly didn't think about like the leader being vulnerable and how honestly refreshing it might be for a leader to be open and honest about, and not, I also believe that a leader should be as private as possible, maybe in certain circumstances.
Yeah.
But to have
it's
that,
it's
you have to. It's like, is it a balance?
It's juggling that, because and don't get me wrong, like this is going to be something that my team sees and doesn't know about me, because I think same thing. Like I'm not saying that that any leader or anyone should just go out there and
I'm
just
depressed
and say it's more about being vulnerable at the right times, and more from a perspective of being empathetic to your team, being empathetic to their needs, recognizing that someone who's a high performer who's having low performance or something's like being able to see beyond just work. And same and in working to encourage it, you don't have to share your personal story, but I have been able to relate to people, and I hope that they've come to me partially because of that in more recent years.
And they feel more comfortable talking.
because I can empathize with them. I'm not the person that can fix them or help them to that degree, but I can provide them the resources. And at the end of the day, I want to make sure that they know that I care about them, that I do have the ability to empathize with some of their situation, and can come from a place of understanding in why I would recommend that they, utilize resources and go to, whatever it is for them.
That's huge.
And also then too, I think we run into, from a leadership perspective, like, yes, we have to manage absences and these types of things, and people are, but that's another thing. Like, people don't feel like, you said it before, around like, physical health, like mental health is health. And I think, it's still not the case. And we as medical professionals are still working on that. And, but that's something as leaders that we can make sure that we're continuing to advocate that, if you are sick in terms of a fever, virus that you could spread and you wouldn't come to work, well, your mental health, and if you are in a place that, that you are not going to perform well, that you are not going to provide the best care, and you need to take care of yourself, then that is just as important to take that day off for that part of your health as it is for if you were in bed throwing up or couldn't, you're still not, you're not at your best. You're not, and I know this is something that I do like this. I'm not typically a cliche person, but this one, you can't pour from an empty cup.
Yeah.
Is something that, even though it might be cliche, it does resonate.
Right.
Because I think a lot of us in healthcare, our whole focus is everyone else. And how do we help other people if our cup's empty and we're not helping ourselves?
Mm-hmm.
And there's just, you have to put yourself.
You have to take care
first,
of yourself.
At times, and yeah, take care of yourself.
Brian, for the last question, how are you doing today?
That's a great question. I am doing wonderfully.
Mm-hmm.
And I think that's a big part of this is I am in such a happy place.
Very good.
I still struggle.
Yeah.
I don't, I leading up to this podcast, I had a lot of reoccurring. I had some crazy nightmares, that kind of touched on my weight and touched on things from my past. I don't know if it was because I knew what I was going to be talking about, or just maybe some of that anxiety and concern, like I'm not, should I be doing this, or am I really qualified, or like why why me? Why would you guys want me on this story? But again, self-doubt.
Mm-hmm.
But I know how to deal with those feelings now. I know how to work through them. And that was, a byproduct of really working with, getting the help, talking to somebody who gave me the tools to, whether it be journaling or doing, other tactics, to combat those feelings. I've got the most amazing family, like 2 little kids. That my daughter wrote me a little note that said, "Have fun in Texas. I love you," which I took with me. But yeah, and my amazing wife who supports me through everything, and so I think that's where coming and being in a place, for so many years of feeling alone or feeling like things were never going to get better and there wasn't a way that they were going to get better and I'd be better off gone, or those types of feelings. So I really want to make sure that people know that things can get better and they will get better, and to take those steps because of all the things, all the happiness that you don't want to miss out on, and all the great things in life.
That's amazing. Quite truthfully, your advocacy for mental health and what you've done in our industry is so inspiring. What advice, before we wrap up, what advice would you give someone in the healthcare industry? Maybe they're a fellow EEG tech who might be struggling right now. What's that piece of advice that you would give them?
I think the biggest thing is having the strength to ask for help. Having that strength. Don't, not looking at life or needing help as a weakness.
Yeah.
I think that's different for everybody though. I think, trust in the people that you love in your life, that, that they will understand, that they care more about you than you maybe even realize, that like they're not going to think differently of you. And I think that's where it comes down, is being able to confide. And I think the other thing I would say is, I think from the flip side, I think it's just as important when you see somebody struggling, to show that person you care.
Mm-hmm.
Be the person that doesn't, not force, but like that they know that they're cared about and they're not alone without even having to ask.
Right.
So you see your teammate struggling, you see somebody, like I said, maybe not performing at their A game, not just assuming, but, just like sit down and just, hey, is everything okay? You know, is everything going all right? You know, you're doing okay? You know, just letting them know that you care, that you can confide in them, I think.
And even if they don't open up to you in that moment.
But you show them that they can.
Yeah.
And definitely, don't force things.
Yeah.
You don't want to force someone to talk, but a lot of times, you know, from my perspective too, is like that can be a stepping stone for them. That can be that that gets them to that next step of the next time they feel that way or the next time they're challenged, remembering, well, you know, so-and-so, and either they come to you the next time or they just know that it just solidifies and starts to form a framework for them that, you know, I'm not alone.
Mm-hmm.
And that maybe I should talk to somebody, or maybe I should just, you know, reach out. So I think it can work hand in hand. And I think one of the things, I see it from like a leadership perspective. It's something that I hold with me, but I do think it kind of bleeds into the mental health side of things too. And just helping others there's a quote that I love from Adam Grant that's the most meaningful way to succeed is to help others succeed. And that's really that's what I see myself from a leadership perspective, but that's also from a very personal perspective, because people can't succeed in life without that help. And when you look at how I can help someone else succeed, whether it's personally, professionally, that to me is kind of how I've translated my need to help people into my leadership role.
Well, this conversation, I can't help but think is helpful for people out there. I think it is something that needed to be talked about. If at the very least it helped me, talking to you has been an absolute pleasure. And I think for Mental Health Awareness Month, this couldn't come at a better time. So thank you so much for opening up. Couldn't have been easy. I know it's hard for me to open up with just little things. And you were very gracious to open up about the biggest things in your life, all in the spirit of helping people. And I know that's who you are. And I just want to say thank you so much for this conversation. And it's been an absolute pleasure.
Well, thank you.